The CDC statistics are alarming. More than 1/3 of adults in the U.S. are obese. You likely know that obesity can increase your risk of diseases such as high blood pressure, diabetes, and heart attack. But you might not know that it also increases your risk of a condition called obesity hypoventilation syndrome, or OHS. And doctors at Mayo Clinic say if left untreated, OHS can destroy the quality of life and cause heart failure.
A sleep study is one of the key tests doctors use to diagnose a condition called obesity hypoventilation syndrome, or OHS.
So obesity hypoventilation syndrome is a condition where people with greater than ideal body weight perpetually underbreathe.
Dr. Eric Olson says OHS is more dramatic at night, but it's also present during the day. It can happen to people who are obese with a BMI of 30 or more because their bodies can't compensate for the stress of the extra weight. Oxygen levels go down and carbon dioxide levels go up. Over the short term, OHS, which is often accompanied by obstructive sleep apnea, causes poor sleep, headaches, daytime sleepiness, and a general feeling of being unwell.
Over the long haul, you start to get complications primarily related to the heart.
As oxygen levels drop, vessels in the lungs constrict, making it hard for the right side of the heart to pump blood from the extremities back to the lungs for oxygenation. Over time, the right ventricle becomes enlarged and eventually wears out, causing heart failure. If you're diagnosed with OHS, it's important to get on the right treatment, and that involves using a positive airway pressure device, either CPAP or a bilevel pressure device. CPAP, which is also used for sleep apnea, keeps the throat open when you sleep by providing continuous inward flowing air pressure. A bilevel device boosts the breath taken by the patient. The bigger the breath, the more oxygen goes in and the more carbon dioxide goes out. A sleep study can help determine the appropriate PAP device and settings.
So patients who start PAP therapy feel better very quickly.
Dr. Olson says you should see a healthcare provider if you're obese and have symptoms that include snoring, halted breathing at night, waking up at night, daytime drowsiness, swollen legs, or shortness of breath. The right treatment can help you get a better night's sleep and therefore a better quality of life. For the Mayo Clinic News Network, I'm Vivian Williams.
Dr. Olson says losing weight may also help people who have obesity hypoventilation syndrome.
And now a recap of the headlines. Police investigating the fatal traffic collision between a scooter and a taxi. Community, businesses, and the government support St. Vincent Association's flood relief drive, along with Rotary and Red Cross. The BVI Athletics Association presents dozens of awards to outstanding athletes. Minister Walwyn underscores the benefits of the reserve fund. The BVI Health Services Authority honoring the spirit of giving to patients, the community, and to each other. And the arrival of 4 new babies on New Year's Day sets a new record at People's Hospital. In news from the region, St. Lucia, Dominica, and St. Vincent begin recovery process after devastating flood killed 19 and wreaked havoc to homes, businesses, and farms. And the Cayman Islands is looking toward medical tourism with the opening of a mega hospital health city. Remember to visit jtvlive.net for more news, JTV's television programs, community and government events, as well as sports updates. You can also watch this entire newscast on jtvlive.net. Additional information can be found on our Facebook page, facebook.com/JTV55. Please remember to like us. We welcome your questions and comments. Email us at jtvnews@hotmail.com. I'm Ino Suman. Thank you for watching.
Wardrobe provided by Umi Fashions.